One in 4,000 women in the U.S. will die related to pregnancy or childbirth. In Sierra Leone, it's 1 in 17.
But that's how this whole concept started. Seeing young women dying from childbirth, you know, just caught my heart, and I wanted to make a difference.
Keeping moms alive is making a difference. And believe me, you keep a mom alive, you have changed the world.
A lot of times, women would be walking 3, 4, 5, 6 miles in labor to try to get to the community health center, and that was, you know, a major contributor to, you know, maternal death and infant mortality within Sierra Leone. They realized that what they really needed was a place where the pregnant woman could come that was close enough to the community health center where they could give birth safely.
I was present while the home was built and saw it go up, literally stone by stone. Just an incredible experience, and you could see what it meant in the community because it's putting down roots.
Opening the birth waiting home really has given us a lot of credibility because it's a beautiful facility and it's on a main road.
Since we opened the building 2 years ago, over 300 women have slept there, and they all go home happy with their baby. That's a big success.
You could just see hope and love and commitment coming out of that project.
We have not had death, you know, due to those complications in the past since we opened this home. That's a big, huge story for us. It makes us want to do more.
First, we thought about not just helping the women, but the children, because the first month, the first year of life is very critical. A safe delivery is one thing, but the children have to be immunized. So we looked at under 5 vaccines, making sure that all the children in the village are immunized.
Motorbike clinics, you know, mobility. I mean, that was one of the original ideas.
So that the clinic can go to more remote villages with their health care supplies and actually deliver care there.
So that they can help sicker people in these communities that can't come to the clinic for health care access.
The government clinic was a partner right from the get-go. I mean, we've been supplying them for years, but there are some very big holes in terms of what they've got on their shelf.
So that's kind of the easiest first thing we can do, and we actually have a system where we ship supplies over by these big blue barrels every 4 months.
They had traditional old ladies that used to do deliveries, and they do it very well. They just don't have the equipment or the knowledge to move beyond complications.
Most of the groups that you see singing and dancing are these traditional birth attendants who are now called community health workers because they have been, through our trainings and some government trainings too, have been raised to a much higher level of skills. The part about malnutrition, over 30% of the children in the country are malnourished, and that's the way it is in the Taconco chiefdom. It's probably even higher in the rural areas. If you don't have good nutrition, you're so much more susceptible to disease and dying from disease. So nutrition is such a part of health.
These cooperative farms, you help them launch, about $150. We'll buy enough ground nut seed, peanut seed, to plant about 4 acres. And voila, you've got 4 acres of ground nuts, you know, in a few months. And that's real food in real people's mouths.
So we're really trying to build relationships, start small, raise funds, and see how we can help more people.
I think of our program as being centered around love and service.
One of the most beautiful things about working with Rhci is the fact that it's small. It makes it personal.
Every time I go there, I realize so much more about how we're so much alike. You know, their family structures, their wants, their needs are so similar to ours.
Seeing women giving me stories over and over how their life was saved, how they were able to save the life of their babies, otherwise they would have died, and it's because of what we are doing over there.